for those that don't know you, you're Gaibrie Stephen,
That's correct.
and you're a doctor, you're an ER physician, and you've also been super vocal during this pandemic, both on your like social media, but also like advocating directly to the decision makers. So I'm really excited to speak to you because something that we're really passionate about on our project is equitable change and not really leaving anybody behind. So before I run away with it, maybe you can tell us a little bit more about yourself. I did try to creep your LinkedIn, but I was like, he'll do a better job than I will at describing himself. So yeah,
Yeah.
if you want to start with that, and then yeah.
Thank you again so much for having me. So it's funny, like my LinkedIn, I haven't updated in probably a year and a half. So it's so funny. If you saw my LinkedIn, I don't even know if it probably has my current job on there, but so yeah, I practice emergency medicine. I practice in the region of Peel. So that's where I've been working for the last year. So I'm actually new to practicing independently. So I just finished my residency actually last July. So
Congrats.
I, yeah, so I kind of tailed off the end of my residency in the pandemic, and then sort of started as an attending like my independent practice in the pandemic as well. But I also do work with a group called Decent Work and Health Network, which many of you guys may have seen their work in posters. They've
Mm-hmm.
been an amazing group of organizers. They're associated with the Workers Action Center here in Ontario, and they were basically the organizers that put forward much of the details around paid sick leave policy. And so that's really what got me in the world of advocating in terms of political advocacy was paid sick leave specifically.
Well, yeah, I've seen all your posts. I've seen everything you've been sharing. I love it. It's so easy to understand. Um, what I think is really unique about your experience is that you're seeing it from the emergency room. And I feel like that's so different from most of us who, have the privilege of staying at home or uh, don't have to look at the pandemic every single day in the same way that you do. Could you tell us a little bit about that?
Yeah, so I like emergency medicine. Actually, I like medicine in general because it's a really good opportunity for you to really see the human condition in a way that you're often not able to do in most jobs. So medicine and healthcare really gives you a front row seat to what life really looks like, and you get invited into people's lives, and you get to learn about different narratives. Emergency medicine specifically is interesting because emergency medicine in the emergency room is a bit of like a microcosm of the rest of society. So when there's opioid epidemics and the opioid death crisis and people are dying, I see that in the emergency department reflected. When we're seeing winters that are cold and harsh and our people are unhoused and living on the streets, we see complications of that in the emergency department also. So it's the same thing as well with this pandemic. We've seen different faces of this pandemic through the different waves. And certainly the disparities and health disparities of individuals coming in with COVID-19 is so clear in the emergency department because we see the worst of the disease and we also see the worst of the health outcomes. And so that's been really eye-opening for me. This is actually what got me into talking about paid sick days. For those of you who might not know, the region of Peel has been incredibly hard hit with COVID-19, largely through essential workplaces. So when we look at stats, we know that 68% of workplace outbreaks in the Greater Toronto Area come from warehouse and distribution centers. Largely they're in Peel. And so when we hear in the news about Amazon outbreaks or outbreaks in factories, many of them are my patients, people that I take care of. And so, in the region of Peel, 1 in 4 people went to work sick with symptoms, and 66% of people in the region of Peel that got COVID-19 got it from a workplace outbreak. So that's just the stats, and that's what I see also in terms of what I do, and it's really hard to ignore that when you see it up front.
Yeah, and I think it's for a lot of us who aren't in essential work. Um, it's hard to sort of wrap our head around the idea, or are privileged enough to have paid sick leave, or a good enough relationship with their boss that they know they can, advocate for themselves. What does that, like, who isn't accessing paid sick leave right now, um,
Hmm.
that you're seeing that maybe would surprise us? Um,
Yeah. So the reality about, so I mean, now we have, to answer this question, I'll give a bit of a background to where we're now and where we were a year ago. So paid sick leave is a policy that the Decent Work and Health Network has been pushing for many years. It's not new. The reality is, I see this in my work pre-pandemic, and I saw it all the time. It's obviously highlighted now because a lack of paid sick leave is impacting everyone, because now it's causing spread of COVID-19. But let's take 2 years back. I was in residency. I recall a patient that I saw overnight with a diagnosis called heart failure. They came in, they're in their mid 40s, and they were struggling to breathe. I recommended that they be admitted to hospital, and they said, "No, doc, I have to go to work." And they said, "Sign me out. I can't stay here in hospital." And and the reality is, in those situations, that's people have the right to make any decision that they want to make. So we let people sign out of the emergency department. Some of these individuals, like this person, comes back to the emerge 2 days later because they're even sicker. And the reality is, as an emergency physician, my job is to identify medical emergencies. But when you identify a medical emergency and a person signs out because they need to go to work, it's very clear that many workers in this province aren't necessarily working to thrive. They're working to just barely survive. And that's
mhm.
that's the reality of what this has always been. And so we've been calling for this for a long time. Where we're at right now is that we do have 3 days of accessible paid sick leave policy. So if someone needs to call in sick, they can call their employer, and they're entitled to up to 3 days before they have to apply for additional policies through the federal government. I'll tell you the people who aren't accessing this. So just a couple of days ago, I had a patient who is a factory worker. So they don't speak English, and they needed to get a COVID test because they had symptoms of COVID-19. And I recommended to them that they stay off work for the next 2 days. And they said, "Doc, like, I had to use a translator device." And they said, "Doc, like, can you write me a note to say I have to get paid for the next few days because I can't miss work?" And I said, "Well, listen, actually, did you know that there's a new law that just came out a week ago? And in fact, your employer has to pay you for 3 days." Um, they said, "I had no idea." But then I had to sit down and explain to them, well, how does this work? You have to call your employer. You have to do this. And then after 3 days, if you do have COVID and you need more time off, then essentially what you have to do is send in a written letter to the employer. Now imagine what that looks like for someone who doesn't speak English and may not have the same access to this kind of information, or even know how to craft a written email advocating for
Mm.
themselves to their employer. Then on top of that, I had to explain for another 30 minutes about applying for CRSB through the federal government. And I recommend anyone listening here to look at what CRSB looks like and what that application process looks like. Now imagine what that looks like to someone who might not speak English. And so this is the types of individual, these are the people that are not accessing paid sick leave, right? And this is why we're seeing these outbreaks in these settings.
That's so frustrating. I can't imagine having COVID and having, like, the first priority should be, how do I get better? Not, I have to make ends meet. How do I keep my job so that after this pandemic, or after I have, like, get better, I'm able to go back to work? Like, what a burden to put on the individual who's got diagnosed with or got COVID-19. Like, it's terrifying. I feel like that's really like upsetting to hear. But um so, like you were saying, paid sick leave has been an issue for some time, but now we're seeing it be such a big issue because of the pandemic. Why should someone like me, who lives at home, and gets to work from home and study from home, care about the paid sick leave of somebody who isn't me? Like, what does
Yeah.
that have to do with all the people who are not like that it isn't an issue for them that they have more than 3 days of paid sick leave.
Mhm. I mean, there's two factors here. One is a moral imperative to care about your neighbor. So we all commit to living in a society, and I think there is something crooked about a society that focuses on improving wealth, for example, or focuses on economic growth and doesn't improve the lives of people who are living in the society. And so, from a purely moral, humanistic standpoint, people should care when we consider the fact that 70% of low-wage workers here in Canada have no access to any paid sick days. So I think that's one piece. And then from the other standpoint, there's also a practical component here as well. Paid sick leave is a policy that has amazing evidence. So when we look at other jurisdictions, to put it into perspective, Canada is in the bottom quarter of high income countries to not have any sort of acute paid sick days. So if you look at the United States, San Francisco has been providing 9 days of paid sick days since 2007. New York actually doubled their paid sick leave policy to 14 days during the COVID-19 pandemic. And so when we look at jurisdictions where paid sick leave policy exists, we know, for example, in studies that US jurisdictions with paid sick leave sees a 40% reduction in influenza rates every year. We know that in 2009, with the H1N1 pandemic, an absence of paid sick leave and workers going to work sick resulted in upwards of 7 million additional cases of H1N1 in the United States. And so we have lots and lots of evidence to support this. So from a very practical standpoint, if you want to get out of this pandemic in a meaningful way, and if you're interested in saving people's lives, then paid sick leave is an important policy that you should think about.
So if I didn't have that moral imperative, or if I couldn't bring myself to care because this is an exhausting time, the only way through this pandemic is mitigating the spread of the virus, and we know that paid sick leave actually does that.
Yeah.
And so it should be something that we're all advocating for, even if it's not something we're personally experiencing or something that we aren't seeing from a compassionate perspective. As we hit because our lives are 30 minutes, if there are any questions for Dr. Gabe that you want to drop in the chat or anything, please. I always forget to say this, and then afterwards we get people messaging me like, I had a question, but I didn't know if it was time to ask. Please put that in the chat and we'll do our best to get to them. So I guess, whose job is it to provide paid sick leave? How do I get that person? Okay, I feel like we can just say it's Ontario's responsibility to do that. Why did they only give us 3 days?
Yeah. So it's an interesting question. Like, whose job is it to provide paid sick days? So I think a lot of people say, give me paid sick days now. And I think a lot of people assume that this should actually be paid for and delivered through the government. In fact, actually, Decent Work and Health Network and Paid Sick Days advocates are actually advocating for employer-provided paid sick days. So paid sick days is a fundamental labor right. If you think about, I'm sure there are people here in your life that have access to paid sick days. Their workplace provides them with paid sick days. And that's just a basic labor right. Imagine that there are people in this country that work minimum wage and they work 40 hours a week. So they take home about $25,000 a year. Imagine living on $25,000 a year in a city like Toronto, for example. That is not a livable wage. And so for an individual like that, to miss even a single day of work means that they were barely keeping their head above water and now they're drowning. And so it is a moral imperative for employers to provide it. And when we look at jurisdictions where paid sick leave has worked, employer-provided paid sick leave is the only way that this actually works. Because when you're expecting the government to provide it, it normally results in some sort of application program, which burdens the worker. And there are lots of barriers to these applications. So that's one piece. The other piece is people will talk about who should pay for paid sick leave. And so this is a myth that I just want to really quickly address. a lot of people worry that paid sick leave will hurt businesses. I want people to check out this organization. It's called the Better Way Alliance. They're on Instagram as well. So they're a group of over 60 small businesses that have come forward to say that paid sick leave is not an expensive policy. When we look at the data again, looking at San Francisco and other jurisdictions like New York, the increase in cost for businesses to providing paid sick leave is actually very, very low, if not zero, because there is a lot of harm to people coming to work sick. It means that they spread communicable diseases to other people in the workplace. So we call this presenteeism, meaning showing up to work sick. That has actually a high cost compared to the cost of absenteeism, which is staying home. In fact, in some studies, it can be up to 10 times more. And so paid sick leave advocates truly are also advocating for employer paid sick leave. The reality is our sick leave policy here is actually government paid. So the way it works is the employer will reimburse you, and then the government will give the employer up to $200 a day for 3 days. There's a lot of problems here. One is that we're subsidizing a lot of big corporations like Amazon, for example, or Walmart, for example, or Loblaws that could very easily afford paid sick leave, but we are subsidizing them. It's a big corporate subsidy. And then the other part that's a problem here is that employers that already provide paid sick leave can't access this pot of funds. So you're actually harming employers that disincentivizing employers that are good actors here and providing paid sick leave while supporting businesses that don't. So for a lot of reasons, I guess this is sort of a long answer, but I think this should be employer provided. And I think that's the way this should be.
For sure. No, sorry, let me rephrase that. Why does the government have to mandate it in order for
Mm-hmm.
it to happen? Because I agree. I do think that it should be employee or employer funded, but why is a lot of the advocacy efforts going towards the Ontario government instead of Walmart, Loblaws, and Amazon?
Yeah, so for those of you in the chat who might not know about this, there's something in Ontario called the Employment Standards Act. So this is basically a piece of legislation that governs all of the basic rights for employees that are working in Ontario. This governs everyone except for example, federally regulated workers. That's a whole different labor code. But essentially, people assume that everyone in this country, for example, has access to a minimum wage or access to overtime or time to eat or sleep during work. This is actually not the case. So over the course of the last 2-3 decades, there's been a lot of lobbying efforts that have created a lot of these special exemptions to the Employment Standards Act. So if you just want to Google Ontario's Employment Standards Act special exemptions, you'll see, for example, farm workers, for example, have no access to minimum wage. That's not actually something that they're entitled to. Many employees in this country are not entitled to paid sick leave. And so expecting companies, for example, to provide paid sick leave in a lot of ways is somewhat wishful thinking. What we really need is actually government mandated employer provided paid sick leave. So legislated through the Employment Standards Act, so all employees get paid sick leave regardless of what industry they're in, regardless of if they're a temporary agency worker. And so that's the reason why we're calling for the government to mandate this.
Okay, that makes a lot of sense. I'm going to look into special exemptions. I never have actually read it, and I feel like, it's just going to make me angry, but I feel like it's a sort of anger that can fire up a post. So,
Yes.
the other thing I sort of wanted to add, or ask rather, was just around what do you think people watching this now, and we get a lot of people who watch it after the actual live, what they can do. Because I'll be honest, like I've written, Paul Calandra is my MPP, and I have sent so many tweets and so many emails, and I've gotten nothing. Like, at least acknowledge my existence, sir. Like, so frustrating. But I keep sending emails because it just feels like something that can be done. But it is exhausting and it is frustrating. So do you have any advice or anything that we can do as individuals to advocate? Um,
First of all, I just want to like empathize with you there. There was a time when I was calling Doug Ford every single day for I did this 30-day challenge of trying to call Doug Ford. I made it to day 15 because I never got a call back. And same thing with my own MPP as well. It really makes you question how much of a civic democracy we live in if we
mm,
can't engage with our um, own representatives that are elected. But that's a whole other issue. I think the easiest way I would tell people to get engaged is to follow organizers and organization groups. So, a group that I would recommend that people check out is the Decent Work and Health Network. The other group also is the Justice for Workers campaign and the Workers Action Center. So, it has been so empowering to be able to engage with these organizers. And one of the great things that they do is they'll arrange organizing events where you can basically go on Zoom and be in a room with 400, 500 other people that believe in the same cause. And there's a feeling of unity and empowerment there. You can call your MPPs together. It's a community event. You can go to days of action. I think the way that we can really make change is to make a movement, right? And that's what we've seen with paid sick leave. I want to remind everyone that we have 3 days now. That's huge. It wasn't long ago, it was approximately 3 weeks ago that our
mhm.
premier went on national TV and said paid sick leave was a disingenuous policy and that people were playing politics. And so this is what happens when you hold power accountable. At the end of the day, we all are here and we are all part of this project that we decide to call Canada and Ontario. And I think it's really important that we have the opportunity to engage and make our voices heard. So organize.
Yeah, I love that. I think one of the biggest things I've been wondering is like, who does it serve that they're not calling us back? Who does it serve that it's difficult to
Mhm.
civically engage? Um, and it's because it's not us. Like, I don't feel heard or valued, and I pay taxes. I show up
Mhm.
to the polls. Um, and somewhere along the line of our representatives representing our interests, they started representing their own interests. And that's fundamentally unacceptable. So that's something I think as a project with the OnCanada project that we've really been grappling with is like how to put the power back in the people because we're the ones who should be dictating policy, not the other way around. Um,
Yeah.
so yeah, oh, that just makes me so angry. But yeah, I can't believe you made it to day 15. I feel like I would have cried by day like 4 or 5 of that.
It's all documented on Twitter. It's funny. This was the time when I was way more unhinged on Twitter. I feel like I've calmed down a little bit. I've received advice to not be like at the premiere all the time. Uh,
Really? I do that
yeah,
all the time.
I did all the time. I now I just say the Ontario premiere a little bit, but you could probably still find it. I was definitely like calling him every single day, and it's funny that I mean, it's actually really easy. I recommend everyone listening right now to call Doug Ford's office tonight and see how easy it is. Like, you'll reach someone on the other line, they'll take a message for you. It's usually someone probably around your age or maybe just a little bit older, and they'll say, "Great, okay, I'll pass this along to the premier." I mean, whether the premier calls you back or not, they probably won't, but it is definitely powerful for the premier to be told every morning that they have 18, 20 messages from the Ontario people calling for paid sick days as an issue. So that'd be great.
Yeah, I mean, we have to hope that if we make enough noise at some point, I mean, a provincial election is coming up.
Mhm.
Um, and while we have to fight this fight now, there's also a much bigger fight down the road of making sure our voices are heard. However, you want it to be heard, but like your voice matters. So um, people should be listening to it.
Mhm.
With the last 5 minutes, or I guess 4 minutes, is there anything else you wanted to add, or if there were any questions that
Mm.
anyone wanted to send in? Yeah, thank you so much for doing this. I just wanted to like create space in case there was more that you wanted to say.
No, thank you guys so much. And I'll say the other reason I don't at Doug Ford all the time is also because I recognize. So BC has, for example, an NDP government, and BC also didn't have paid sick days until today, and they released the exact same, bogus plan that Premier Ford released as well. So I think as people, we have to hold all power accountable. And
Mhm.
so in an effort to do that, I just have tried to just call everybody out
I
equally
respect
as
that.
much as I can. Because yeah, I mean that's just the reality. I mean, as a physician, I will say that I get really a lot of privilege in hearing a lot of narratives that I think is often not reflected in the wider media.
Mhm.
I have many patients that are temp agency workers, for example, who are some of the most marginalized workers in this province. And many of them exist in the region of Peel. Temp agency workers, imagine this is an individual that often are racialized individuals that are working from factory to factory. In a week, they may go to 4 or 5 different factories, and every morning they're just waiting on a phone call to get work. It's not because they don't want to have full time work. It's because the way our system exists, we often fund temp agencies instead of full time work because it's
Mhm.
cheaper. Employers, for example, are not held liable for workplace injuries when they have a temp agency worker. So these factories will hire tons and tons of these temp agency workers. Temp agency workers are not the ones that are coming on TV to speak out about these issues because they are very much, they could easily lose their job. If they spoke out about this issue, for example, they may never get called back. These are the narratives that I get to hear as a physician because I care for these individuals. I don't see this often reflected in media. So I want everyone to just recognize that, there are a lot of voices in this country, and we have to pay attention to who doesn't get a platform. And it's sad. There's a lot of people that don't get a platform to
Mhm.
speak on these issues.
Oh, well said. Yeah.
Mhm.
Thank you so much for being here and chatting with us, and also for all your work on the front lines and also on Twitter, advocating. Thanks so much. And
Thank you.
I will tag you in all the accounts that you mentioned in the post thing. So, yeah,
Thank you so much. And thank you so much for giving me this space. I really appreciate it.
of course, anytime. Come back whenever.
Thanks. Take care. Bye,
Everybody,
guys.
bye.